Thanks, Samson. I mean, the whole issue around vaccine manufacture is that Africa doesn't have a large manufacturing capacity. There are only 10 sites across 7 countries in the whole of the 55 countries in Africa who actually produce vaccines. And why is it the case? Because historically, diseases that require vaccination have disproportionately affected countries where, standard of living are low, purchasing power parity is low, and all that. So there is not a lot of money involved in the pharmaceuticals of vaccines. COVID has come in and it has tipped that uppercut. And that is why you realize on average, new vaccines come every 8 to 10 years. This one has come in less than a year. And people are raising questions. It's because of the fact that dynamic change. It's nothing like Ebola or dengue fever, malaria, and therefore the West do not have to be involved. This time they've had to be involved. What it now means is that African countries have also come to the realization that they cannot be reliant on these countries when a huge pandemic hits to supply them with vaccines, because unlike the diseases that I referred to previously, which do not affect these countries, even if they get the vaccines, they keep them in store for a public health emergency, but they have no real use for them in their country. So they would supply to Africa, like the childhood killer diseases and all that. But when there's a global need, then we go further down the pecking order, because they will prioritize their citizens who pay the taxes to ours. So what basically is happening now is we need to up the game when it comes to vaccine manufacture. You need to look at your pharmaceutical industry. You need to look at those who have the capability to produce vaccines. They have what we call the ability to produce under aseptic conditions, because you don't want your vaccines to get contaminated. You identify those. You need to then get into bilateral agreements, because they need to be agreements with the people who hold what we call the market authorization, the people who actually made the vaccines and hold the patents, who will give you authority to manufacture. You need to then go into some form of collaboration to be sure that you can simulate their manufacturing chain, what we call good manufacturing practice. All these things would have to be looked into. And when they are looked into, your local regulator, which is the Food and Drugs Authority, also has to certify that the quality of production is the same as the quality of production in the country from which the vaccine originates for. That is where the political will is needed. And I'm glad that now government has realized, because to answer your question, why didn't we do that? This was what some of us were talking about as far back as May, June last year, that this is the approach to go, because that was what Chile did.